Okay, seems to be going. Yep.
Hey guys, Dr. Jake here.
Should be working the eye test. Looks in my pocket.
There you go.
Everyone, hello. Tuesday, I'm just going to hold it between us.
Yeah, that's fine.
Just pick it up. Dr. Erickson, EHS Physical Therapy. Of course, inside, Essential Motion Spine and Sport, our partnership, our collaboration. This is what we do, and we're going to come at you hopefully consistently. We got Dr. Jake here now. So, graduated. Jake's the real deal. Everything is, in motion to get credentialing, all that kind of stuff.
Yeah, it's all in process.
We've gotten through our holiday season, right? Christmas, New Year's, new start to the year. Actually, Jake and I both got through our having the COVID, so we're all good with that.
We're survivors.
So, yep. So we're actually feeling pretty good about this kind of stuff. We're going to start talking to you. January is still talking about the ankle, right? Foot, ankle, calf, that kind of stuff. But what if you're just having, calf or foot, ankle, heel pain, right?
Yep.
But it's caused from maybe a back injury. That is, it's not the most common thing, but it's definitely possible. So we've talked about different foot and ankle things, but let's talk about, tell us what could cause, a herniated disc that would then cause a secondary effect would be, calf pain, heel pain, foot pain, maybe to the big toe, maybe to the outside of the foot. What would kind of cause some of that stuff? And what area?
Yeah.
Like what area of the lumbar spine? Like on the upper, in the mid,
Right.
in the low? Like where would that come from?
Yeah, so most commonly, the reason why a disc injury happens, it isn't just one specific thing that makes it happen. Mm-hmm. It's usually repeated loading until the point where the tissue just can't handle that stress anymore. So commonly, it's usually with repeated bending, with picking something up, or with some sort of load that you're placing on that lumbar spine.
Or flexion with some rotation of some kind.
Yeah. So usually if you're feeling it in the ankle area, it's going to be that lower lumbar, like L4, L5, L5S1, probably a little bit more commonly in the ankle. And
that's because these little spaghetti strand nerve roots. Yeah. I'll get on the back side so I can see this. But that's because those spaghetti strand nerve roots are very specific and go to specific parts of the body. It's called the dermatomes and myotomes. I apologize. So the dermatomes have to do with the sensation. So that's why it can feel very specific to certain parts of the body. So that's exactly why that would feel that way. And that's how we would know. That's how you wouldn't have to go, and I need to get, an MRI and spend $1,500 to show what level it's at. Well, based on your symptoms, we can pretty much be sure where those symptoms are coming from because we're all built the same way.
Yeah. So with an L5S1 disc bulge or disc injury, you can kind of feel those symptoms. Possibly, you'll feel them in the calf. You might feel them in the outside of the foot or even on top of the foot. But that calf pain can mimic some other ankle conditions that we see.
You could have, let's say, you have Achilles tendonitis.
Right.
You've strained your calf. Now, classically, we've talked many times about that. Classically, it would come from back, hip, glute, but it does not have to do that. We have seen people that only have hamstring pain, that only have calf pain, that only have heel pain, and then it's really in the history, right? It's not how'd you hurt your calf? Were you running? Were you jumping? Oh no, it just came on.
Yeah.
And can you get it when you're just sitting, not even using your calf? You're on the, you're working from the computer or you're sitting in the car. Yeah, that really bothers me. And then when I stand up, it feels better, and when I use it feels better.
Yeah.
No, it cannot be a muscle because the more you use it, that would make it worse if it was a muscle. If you try to jump or push off or sprint, contractile tissue would be worse. So that it's all in the way you describe it and the history. But keep going. That's good stuff.
So with that pain, if it's coming from a disc or something like that, you might even feel not just pain, but you might have numbness, you might have tingling, you might have shooting. Mm-hmm. That would help us differentiate that from a true ankle sprain or ankle injury or whatever we're talking about. So those are some common things.
Oh, jeez. Yeah. Sorry. There we go. You guys didn't want to hear that phone. Yeah.
That, and then depending on the type of disc injury, you can potentially have, like Chris said, the back pain, the hip pain, the leg pain, and the ankle pain, or you can just have the ankle pain. It all just depends on what area of that nerve, that spaghetti strand, is getting irritated.
And usually it comes and goes. Another pretty good sign. If you sprained your ankle or hurt your Achilles tendon, or calf, there'd be a little bit more consistency in that. Every time I stand up or push off, every time but where these can be, because they're dynamic, could be a little bit like, more random. Sometimes in the first thing in the morning, but then it goes away, and then it just kind of is more random, I guess I'd say is the good word for it.
Yeah. Sitting, bending, those are the kind of things that would reproduce it.
Yeah. So yeah, you were right on with the vast majority of these injuries are not, one-time things. They can be.
Yes, they can.
We've definitely seen our fair share of people who have been hurt with lifting heavy things one time, or some kind of, we don't want that to happen, but some kind of
crazy, something like that.
A slip and fall on the ice, a car accident, like those are always possibilities, but not the majority. The vast majority, people have had some kind of problem with this in the past, off and on. Like, let's just say it's my right side. I've had off and on, like, right low back pain, or glute, or so like butt or hamstring pain, and then all of a sudden, this time I don't feel it there, and now I feel it down there. And they're like, well, it's different, so it's got to be something different. I got to have a calf issue or an ankle issue, and it may or may not be. It just depends.
Exactly.
Okay.
Cool. Any questions, comments?
Yeah, whatever. We'll see if anybody's just watching on here and see if we can answer any questions. I'm going to wave at a few people here that did join us. Yeah, we had a couple people watching. I appreciate that. So we'll come back again in a couple days. We're going to obviously post this, and if you have any questions on this kind of thing, or if you've experienced this, let us know. Yeah. We would love to hear your guys' stories, your successes, and your failures or not successes with treatment. Like, we'd love to hear what's going on with people, and if we can help figure it out, great. Or if we can steer in the right direction, that would be great as well. So, all right. So that's about all we got for today.
Yep.
Next time, we should set up another question and answer session
that'd be good.
at some point.
Yeah, maybe next week or something.
Well, let's do it next week. We'll post it so that we'll give you ahead of time and get your questions in, and then see you guys in a week or so.
Sounds good. See you guys.